All right. Welcome everyone to our exciting Project Finish Line 100 Clinic webinar kickoff. So excited to see everyone here, all the people joining. This is really almost a year in the making. It's a result of so much listening and research and passion from both our team and the clinics to keep us going throughout this pandemic. And we are here to serve those underserved communities and protect themselves and others with our equitable vaccination network. And I just want to start by thanking all these folks that have made this possible. Early funders to this project were the CDC Foundation, the Robert Wood Johnson Foundation Culture of Health Leaders Program, and the Rainwater Charitable Foundation. So I really want to thank them who helped get this going and believed in us. The first funding came in about 8 months ago before there were any vaccines approved, and they really believed in this program. So I want to thank them. As well, shout out to the Sostento team. There's many of them here on the call. Over the last 6 weeks, they've been working on this for almost a year, but in the last 6 weeks alone, they have led 19 orientation sessions with clinics. That has helped us get all 100 clinics onboarded and ready for this kickoff. So shout out to the Sostento team. You are amazing. And all the clinics that are part of this network are going to see that over the next few weeks and months. For me personally, this is kind of a very happy day. Actually, I told my parents flew in this morning. I haven't seen them for 18 months. I told them they're going to have to wait a little bit, go get your lunch on your own, and I will see you in a little bit. So for me, this is like a really, meaningful day for a number of reasons. And I believe it is a milestone that we are at a point where the pandemic, we can take control of it in the United States. And we know COVID-19 is probably going to be an issue for months, if not years to come, but this can be our turning point as we really start to beat it back and take control of it. So some quick housekeeping before we get going in the webinar. Please mute your microphones unless you're one of the presenters. You will not be presenting unless we have notified you beforehand. So if you have not been notified that you'll be doing one of our lightning rounds, sit back and relax. Yes, my colleague Ashani and Emily are in the chat. So if you have any questions at something you hear, Emily and Ashani are in the chat. You can ask them, put any questions, any comments, let them know. As well as my colleague Christine will be running the slides. And in case my electricity goes out or something, Zoom related happens to my computer, Christine is going to take over. So thank you, Christine, for that. And the recording will be shared afterwards of this webinar, both in our Facebook group as well through email. All right, so let's get started. Let's get going. So there was a little survey question that we provided to you at the beginning. So let's see what people during their Zoom calls were. Okay, we'll see that 81%, there's a common theme that most of us take our Zoom calls without shoes on. So at least that's what we're willing to admit. I can say that I personally actually do not have shoes on at the moment. I do have socks on right now. So I would fit into that category as well. So that's great. Thank you for taking a little survey. And this is representative that we're always going to be listening, asking you survey questions, sometimes serious, sometimes maybe a little less serious. Let's see, there's the results. You should see the results of the poll now. Close those, and while we're doing that, I will get through the agenda. So here's our agenda. Today, we're going to do a welcome and overview of the program again. A lot of you have come through orientation. We have a few folks that maybe have not have, so we're going to do a quick overview of the project. We're going to give you some key critical updates related to the project. Go over our funding and operational resource for this month. As you know, each month we're going to be providing one fundraising and funding resource and one operational resource this month. So each month, and we'll go over those during the call. There are some key Sostento updates that I want to provide. And then we'll talk about what you should be doing next after this webinar. All right, so let's go. Okay, so welcome. Welcome. Let's go through the overview. Next slide. And I want to say welcome most of all to all of our clinics. It's so powerful to have you here. The orientation sessions, we've been connecting with you, you've been connecting with us. And I hope that through these orientation sessions, what you felt is that you're no longer alone in this mission to get the last mile done on the pandemic and get these individuals who are under and uninsured vaccinated. There's been such great conversation in our orientation sessions, and that's what this program is all about. It's a network. It's really here for you to connect. We have so many different clinics. I think we really represent the gamut of free and charitable clinics. We know that there are over 1,400 of them in the country, but we have rural clinics, we have urban clinics, we have small and large. We have, I think, some of the newest clinics that have just launched. We have the oldest clinic in the country that's part of our network. And we're all bonded together through this mission and commitment to go the extra mile and I just want to welcome you all to the network. So let's keep it going. So let's start. What I always like to do on the project finish line calls is to look at where are we now. So if you look on December 9th, when we officially launched Project Finish Line, that's about where we thought we were in the pandemic. And you can see as we've progressed each month, we've done check-ins with our network that started with all of our state leads, who I'll tell you a little about in the beginning. And this is where I think we are today as we launch our kickoff into Project Finish Line, the Equitable Vaccination Network, that we are in this phase 7 of the pandemic, that we are post-peak, and hopefully we don't return to the numbers that we were seeing. You know, anything is possible, but I believe we are right now in the post-peak phase of the pandemic, with a possibility of reoccurrences and little outbreaks here and there, but that we are on our way to phase 8, the finish line, if we can continue to do the work. So each month on our webinar, I will kind of do a little look of maybe where are we now. And this is just a quick look at how we've been doing on administering the vaccine since they were approved and released. As you can see, there was a slow kind of build up to April when we hit our kind of max. It was about a little over 3 million vaccinations a day they were doing. But that, as you can see, and I think we've all been feeling as mega vaccination sites have closed, and most people that have easy access or don't have hesitancy have been vaccinated, we can see that those numbers have gone down to where just yesterday, we just did over 1 million doses across the country. And we think that these numbers will continue to fluctuate a little bit up, a little bit down over the next few months during our program. This is just a quick look at vaccinations per state. The darker the color, the higher rate of fully vaccinated adults the state has. And you'll see on the next slide that our clinics are mostly concentrated in those areas with lower vaccination rates by state. We also know that even though there are some states that have higher vaccination rates, that does not mean every community or county is exactly the same. And so this is a look at our network. This is where the 100 network members come from. How were they recruited? Well, these groups came through our state leads. So in each of these states, there is one state association of free and charitable clinics or another entity that is acting as our state lead. They have recruited and gotten the word out about our program and helped sign up all the clinics. Sostento didn't invite one clinic, so that's pretty cool. And shout out to our state leads who have brought this network together from all these different states. And I would say for the next 6 months, you are our focus. We are not going to look to grow the network until we've reached our goals. So you don't have to worry about all of a sudden there's more and more clinics being added. No, you are in the program. You are our focus. And this is the spread currently of the clinics about where they come from. So shout out to all of you wherever you are. Next slide. Just a reminder of our network goals as part of Project Finish Line. Our number one goal is to support each of the clinics in this network with $10,000 in funding to help with your frontline equitable vaccination work. As mentioned, this is going to be unrestricted funding. We're going to let you use that how best you see fit to get the vaccinations done. But it's our goal to make sure that each of you have at least $10,000 that you get by the end of this program that you are putting towards your vaccination efforts. We've already hit our goal of having 100 clinics in the network. So we've checked that one off. And then finally, what we want to do is using that funding and working with the 100 clinic network, we want to achieve 1 million vaccinations. So at Sostento, any initiative we have is always time-bound, it's bold, and in this case, it's 100 clinics, $10,000 per clinic pledged fundraising, and 1 million vaccinations total. So that is our network goal. I want to share one of our resources that we launched back in December when we first started Project Finish Line before this network was built, and that is our education toolkit. Hopefully you've already seen it. If you haven't, we'll make sure that we post a link to it in the private Facebook group, and as well as available on covidfinishline.com. You can go get it there. And inside this toolkit are specific resources that are just for use by free and charitable clinic staff and volunteers. What we've done is we've taken information from the CDC, from state health departments, from other vetted resources, and we've put it into different kinds of materials that we know will be most useful to you and to your specific beneficiary group. So there are lots of visual flyers, social media posts for you to put on your Facebook, Instagram, or Twitter. There are infographics, and there are a lot of talking points for you to give out to your staff and volunteers on the latest kind of questions that you might be getting around COVID-19. We're excited that we've had over 1,500 unique downloads of the toolkit since we launched it. That was our goal, and we actually crossed it just before this webinar. So we're really, really excited about that. And moving forward, well, up to this point, we've been releasing new resources every 2 weeks. From now on, we're going to be doing it once a month. So every month we will update the toolkit. That's where you'll find your fundraising and operational resources, as well as maybe some other educational things. We also have a new partnership with AmeriCares. So I'm sure maybe many of you have heard already from your state leads or AmeriCares themselves. They are doing some surveys now, but they are going to be stepping up on the education front. So we are going to be focusing on the access and fundraising for you all, and AmeriCares will be doing some of the newer education work. Next slide. Yep, taking a look at that's the toolkit. Next slide. The toolkit really wants to be seen, I guess, Christine. There we go. Okay, but really the most exciting part of our network are the clinics themselves. And so we're going to do our first lightning round. This is something we'll do multiple times per webinar. We have 3 of them today. So if you see your name up here, get ready to chat. When I call out your name, you can come off of mute and give us your 5-minute update. But let's hear from the clinics themselves. So again, each month we'll pick different clinics to spotlight and have shared their updates and stories. And here are our first 3. So let's start with Dr. Christopher Irvin from Health Equity for All Lives.
Good afternoon, everyone. And if there's, I think everyone's in this East Coast Midwest. So good afternoon. My name is Dr. Christopher Irvin, and I'm the manager for the Morehouse School of Medicine HEAL Clinic, and that's what Health Equity for All Lives stands, is shortened to HEAL. So the Morehouse School of Medicine HEAL Clinic is a student-run free clinic based out of Atlanta. And so the students of Morehouse School of Medicine, the medical students, physician associate students, research science students, masters of public health students, all work together to provide health care to the uninsured of the Metro Atlanta and near rural areas. And so we were definitely excited to be part of this initiative. And as far as vaccinations goes, our students have worked with our revenue side clinic, which is called Morehouse Healthcare, and our mobile unit team. We do have a full-size mobile unit, which is what you should be able to see in my background. And we've all worked together to provide vaccinations to the community. And so for the month of May, we were working with the Mexican consulate and working with the Mexican community of Atlanta to provide COVID-19 vaccinations, including when Pfizer was approved for 12 years and up, even the youth of that community. And I think we've done close to 600 members of the Mexican community so far. And we're planning our next big vaccination event, which will happen in about a month or so. And that's going to be working with our safety net community and the under-resourced community of urban Atlanta. It's going to be happening at what is called the Curb Market. It used to be a farmer's market based in downtown Atlanta, and now it's being converted to a more community food vendor, food court type market, where all members from everyone to the Grady Hospital, doctors and nurses, to those who are homeless or, undomiciled that live in reside around the area. So it's going to be a very diverse community where we're going to be offering vaccinations to them, and we're gearing up to start working with the public school system to do back to school vaccinations for our young people as they return to the classroom. I think that's 5 minutes.
Perfect. Thank you, Dr. Irvin. And the first time when he came out to the orientation, I saw that bus behind him. I almost thought he was like parked right in front of it. And it was, but it's, I think representative of this outreach that we need to do, that we need to, be able to get out into the community, whether it be by bus or other means and mobile units, pop-up vaccination sites. So thanks to Dr. Irvin. Let's go next to the Midwest and community health. Laura Starr. Laura, come off of mute and give us an update.
Hi, everyone. As Joe said, I'm Laura Starr. I'm the Director of Development and Communications at Community Health. We are a free clinic located in Chicago. We serve about 8,000 low-income, uninsured adults, which in the city of Chicago, that largely means a lot of the undocumented population come to us for care, and we provide primary health care as well as over 20 specialties, an on-site pharmacy, health ed, dental, you name it. We try to be as full service as we possibly can. And so it's been really important for us, knowing that our patients rely on us and often don't have other places they can go, that we be a source for vaccines. So we ourselves have administered vaccines to, oh, that's great. We ourselves have administered our vaccines to about half of our patients so far. We are in the process of gathering information on patients who have already received their vaccinations elsewhere. So early on in the pandemic, we started in February hosting our own on-site vaccine clinics every single week at Community Health, but we also have partnered with the city of Chicago to vaccinate not just our own patients, but we have done 4 or 5 pop-up clinics now in a particular neighborhood in the city of Chicago that is one of the neighborhoods hardest hit by COVID, and where there is a very, very large undocumented and uninsured population. So we've been administering a lot of vaccines that way. We've been sending a lot of patients to City of Chicago mass vaccination sites where they had reserved some special spots just for community health patients too. Now we're in the stage where we're trying to gather information on who has had the vaccine. And so far, we're still working on the data because we're kind of coming down off of the hurry to rush and spend all of our time and energy getting everybody shots in everybody's arms phase, and now moving on to information gathering. We've actually got volunteers who are calling up patients that we don't know about and asking them if they've had their vaccine, where they got it, making sure they're recorded in the state of Illinois system. So, so far about four out of 5 of those patients that we're talking to have gotten their vaccines, which is really amazing. We're thrilled with this result. And those that we haven't reached yet are those that we haven't seen in a while or talked to in a while. And so we're trying to figure out how to tap into that population that we don't have as strong of and as frequent contact with.
All right, thanks, Laura. Always inspired by the clinic, which I believe is one of the largest in the country, correct, Laura?
Yes, we're the largest.
Yep. So we welcome everyone from Laura's group, the largest. I know we have some folks on here that are just open 2 or 3 days a week, and but both sides of the coin are needed to get us where we want to go. But Laura, we continue to learn and be inspired from Community Health, and thank you for that update. Lastly, we are going to head down to the Southwest to Il Milagro Clinic and Marisol.
Hi, everyone. My name is Marisol Resendes, and I'm the executive director for El Milagro Clinic, and we are in McAllen, Texas. We're right on the border with Mexico. We are one of 4 safety net clinics in Hidalgo County, and we serve about 96% of our patient population is completely uninsured. About 98% of them are Hispanic or Latino, and 42% of them are at or below 100% of the federal poverty level. So we provide primary health care and in integrated behavioral health. So we have counselors, we have dietitians on site, we have laboratory services, prescription assistants, wellness activities, and just like community health, we also try to do as much as we can for the patients here. So we just trying to incorporate everything. We have been vaccinated. We're very lucky to partner up with CVS Health since July for COVID testing. So we have a COVID testing site still going to this day. And we provided over 16,000 COVID tests for not just our patients, but the community. And with that partnership then came the opportunity to become a vaccine clinic as well. So in April, we started vaccinating our patients and the community through that big partnership. So unfortunately, because of the numbers, it ended in June 3rd. So 2 months, but in those 2 months, we were able to do 1,300 vaccines. So that's pretty good. We're also, since the beginning, we tried working really hard to get ourselves, credentialed to be able to offer the vaccine here for on our site. So we have that going, and we're on our way to ramping up our efforts through our mobile units. And we're partnering up with the Aging and Disability Resource Center. And to be able to go out to more colonias. We have already done it, but we haven't been too successful. We have only done 120 on our own. So we know that there's a lot more that we can do, and a lot of other populations. We want to reach out to our homeless populations. There's a lot of homeless friends that there are around our area that come and see us for their healthcare needs, but they're still hesitant about the vaccine. So we're just trying to focus a lot of our efforts into getting everybody vaccinated. And we want to, one of our main things, I think, it's having it readily available. We call also our patients to see who has it. Do you want to come in and kind of schedule an appointment? Sometimes it's not too good for our patients if we schedule, things come in the way and they can not make it. So just having it ready to go at, whatever time is convenient for anyone, which has been a little challenging too. We don't like to waste the, we have to give 4 instead of the 10, and then we have to throw away the rest. So it's kind of hard, but that's what we're working on doing. And so happy to be here. Thank you.
Thank you, Marisol. And I think you've reflected a very important point of our network, which is those that are going to partner with vaccination sites. I think about half of our clinics in the network are doing vaccinations themselves. The other half are partnering with their health department, with a CVS, with pharmacies, with anyone who is able to actually administer. And we think that's a very important role to play. I think it's been a little overlooked how much outreach and education and trust building and support that it takes. And that is a full-time, work itself. So we are going to be supporting all of the clinics in the network who are also helping get vaccinations done at third-party sites, or if they want to get help getting ready to do themselves, we have some resources for that. So that was just 3 amazing clinics. And again, if you're wondering, hey, how do I get on the clinic spotlight next time? Well, there's the monthly progress update report. If you submit that, there's an area for challenges and successes. We are going to be selecting from that. So make sure you fill out your monthly report. It's a little plug there, monthly progress update. And that's how we're going to be selecting our clinics to be spotlighted each webinar. All right. Next slide. Let's do some project updates now. Okay, next slide. Okay, so the first very important progress update is about the funding. This is our progress so far. Our goal is to fundraise $1 million, which represents, like I said, $10,000 each for the clinics that are part of the network. And as you can see, we are at $350,000 so far, and that is solid progress. We also have a few more grants out there that we're waiting to hear from that would bring us much, much closer to the goal. So how funding distribution will work, a little update on that. Starting in July, clinics that we have got the letter of commitment for, and we've been able to receive their funding. In July, you will start to get messages about your status and what you will be able to get disseminated to you. And then we're hoping that by August, every clinic will have gotten something. That is my hope. I believe we're on track for that. The $10,000 may come all at once. It may come in different pieces, but it is our pledge that by the end, this thermometer will be at the very top, if not breaking through the very top. And again, as soon as the funding comes in, after July, your state lead will get in touch with you and let you know about how the funding will come, when it will come, and all the other details. You can always reach out to me if you have a concern or if you have a need. Please reach out to me. We can talk about it. But this is our progress, a really solid start. Still some ways to go, but I'm very happy with how the team has been fundraising. All right, next one. Of course, the other tracker that we're going to be doing is how we are doing to our 1 million vaccinations of hesitant and hard to reach individuals as a network. So each clinic, it will be up to you to help us track this goal by submitting your monthly progress updates. We already actually have a baseline from your initial applications. And then at the end of this month, you'll be submitting your first progress report. And then next webinar, we will give you an update about how we are going to the 1 million vaccinations. Next slide. All right, I want to go over some frequently asked questions that we heard multiple times during our orientation. So let me go through those and answer them in case these are still lingering. Okay, how and when will funding be distributed? I just went over that, but again, one more time, that it will be distributed by state leads starting in July. And you can always reach out to me if you have a question about it. So that's funding starting next month. Hope at least something by the end of August, but our pledge is by the end of the program, the $10,000. All right, next. Okay, how realistic is it that we are going to be able to vaccinate 1 million people who are uninsured in this program? So we know that this is a bold number and we will adjust as we go if we feel that we need to. However, as Marisol said that working with her partner, she had over 16,000 people tested. I know that's a little bit different, but we have multiple clinics that also we have helped do over 10,000 tests. So we think that that as an average is something that we can achieve with the clinics here. And some of you in the rural areas that say, oh, I have a population of less than 10,000 in my county. How am I going to do this? Well, we know that folks like Community Health in Chicago in an urban area is going to pick up the slack. We also know that this 1 million will include likely young people, children who will get approved. So as we've seen kind of vaccinations go in waves, it goes down, it comes back up. We also believe that by the end of the 6 months, we may be doing booster shots as well. So that will all be included in the million. Again, we will track and we'll see that if we need to adjust it, but we think it's attainable. And when people go, oh, some people actually go, oh, 1 million, didn't we just do 1 million yesterday? And I said, like, look, these are 1 million that will each take a very special intervention from the free and shareable clinic to get them vaccinated. So that's why our goal is 1 million. For those that say, oh, that's not a lot, I say, well, these are not your normal mainstream, jump in the car and go to the mega site vaccinations. So that is a little bit of the million. Will additional funding become available? The answer is we hope so. So in each month with your progress report, there will also be a section where you can request more funding. We know that some clinics that are, especially those that are doing vaccinations, might need a piece of refrigeration and freezer. They may need help with an outreach coordinator, and that may be more than $10,000. So we are saying that we want to raise at least $10,000 for each of the clinics. But if there are clinics that are doing many vaccinations and there's a bottleneck to have them do more, we will do the fundraising with you to be able to get that additional funding. So your monthly progress updates will be a chance for you to let us know if you need more than the 10,000 and why. And so we will take that as at a case-by-case basis, and we'll talk to your state leads about that. When will the program end? So yeah, sometimes the pandemic has felt like it could go on forever. And so at Sostento, we make sure that our network initiatives do have a fixed end date, and it's 6 months. So today is our start date, and therefore our end date will be December the 15th for the program. At that point, we will, we're not going to leave you. Sostento will be here post that as well to support clinics in a different fashion, but this program itself will last 6 months. And so we hope to send everyone into the holiday season with lots of cheer and excitement that we've reached our goal. So it's a 6-month program ending December the 15th. My favorite question of all, which is, this program sounds too good to be true. Am I missing something? So that is my favorite question to get. No, it is not too good to be true. We are a 3, federally registered nonprofit, just like many of you. It's our mission to serve you. I started the organization because I believed that the front line was just under-resourced and needed another advocate in their corner. And so that is our mission, to serve you. And so at times it may sound too good to be true, but I want to hear you say that more to us. And we will always, we have ambitious goals, but we will always look and try to deliver on our pledges and our promises to you. So if you have more questions, you can put them in the chat. I see that the team is already there helping to answer those questions and help you out on those. And with that, we are going to move on to our state lead spotlights. And with the state leads, these are the groups that have been rocking with us for the last 8 months to get Project Finish Line going and recruit all of the clinics into the network. And so what I want to do is give 3 of our state leads 5 minutes each. And that is going to start with Dennis out in Wisconsin. So Dennis, over to you.
Thanks, Joe. Thanks for the introduction. So my name's Dennis Krajewski. I'm the Executive Director of the Wisconsin Association of Free and Charitable Clinics. In Wisconsin, we have 92 free and charitable clinics throughout the state. And on a basis, we serve about 160,000 Wisconsinites. I'm pleased to say that of those 92 clinics, 12 of them are participating in the Equitable Vaccination Network and doing some phenomenal and exceptional work. So let me spend a couple of minutes here with basically 3 points. One is, what's our experience been over the last year with regard to the pandemic? I'd like to talk then about our relationship and our experience with Sostento, and then a little bit about what we're excited about going forward. So I suspect we're very similar to most of all of you. If I look back on the pandemic, I say it started out with confusion, lack of information and fear. It then migrated into frustration as we were learning more, yet we were missing equipment and we were struggling for PPEs and all to get stabilized and changing all of our policies and our procedures. And then gradually we seem to be, moving into the arena where the light seems like it's showing toward the end of the tunnel. So it's very, very encouraging. What we're very pleased with, frankly, is our relationship with Sostento. I met Joe, I met his team, was introduced to them back in the fall of 2020. And what I saw with Sostento, and I think many of my state peers saw the same, is an organization that was committed, was very much, had the right mission and values alignment, and had services that we couldn't provide. Frankly, I just don't have the capacity, the bandwidth, with 3, 4 FTEs trying to provide the support and the services that we needed through the pandemic. So our partnership with Sostento is really almost a match made in heaven. We were able to leverage their capabilities, their ability to bring knowledge and information, their ability to develop the toolkits and all that. And then what we did in the state is we utilized that, we disseminated that, we distributed very widely in Wisconsin. The clinics used the materials. We had multiple public health departments using the materials. I made sure our state association, our state Department of Health knew of and was available for the information and materials. All of that really, I think, hopefully leveraged and helped the clinics to make it through somewhat the pandemic, but also it built a lot of credibility. I think we've raised our visibility within our state with our public health department and in being a partner in the pandemic and combating with the pandemic. So what I'm really excited about, frankly, is the money is starting to come in. We are starting to get the funding. I know within Wisconsin, I signed contracts last Tuesday. Joe and I are working on, we got the first invoice in, dollars hopefully will start flowing in July. And I'm really looking forward to being able to start disseminating and providing support to all you clinics that have been working so hard and really could use some additional resources, funding, and support. That's what the state associations are all about. That's what we want to do to help. And that's probably the best we can do at this point. So I'll kick it back to you, Joe, but it's been a pleasure. My compliments to you and your team. My compliments to all the clinics on the call today as well. It's just an amazing stuff that all of you are doing that is just superb, just, heartwarming. Thank you.
Thank you, Dennis. We're definitely blushing over here at the Sostento team. Thank you for all the kind words. I will say that Dennis is an example of someone who makes good trouble. He was the one that kind of helped instigate Project Finish Line with some of the other folks, state leads out there, you know who you are, to really get the momentum going and show us what was possible. Because at Sostento, we're a very small organization. We're still kind of in a startup phase in many ways because we were founded in 2019 and we've been just trying to keep up and grow in 2020 into 2021. And folks like Dennis help us grow, help us see what is possible. So thank you, Dennis, for all the kind words and for leading the way forward in Wisconsin and for the country and for Project Finish Line. You've really been a leader of the program. All right, so next, let's move to Ohio. And I think we have Sydney Hatch is going to be representing our Ohio State lead today. So Sydney, if you're here, come off of mute and give us your update.
Sounds good. Thank you, Joe. Hello, everyone. Nice to meet everyone. My name is Sydney Hatch. I am the Director of Engagement and Communications here at Charitable Healthcare Network, which is Ohio State Association for Free Clinics. I am in place of our Executive Director, Deb Miller. She was unavailable today. So in case you've never met her, that is our Executive Director. We have 53 unique members across our state. We serve 69 counties out of Ohio's 88 counties. Last year, we served 35,000 Ohioans and provided $121 million worth of healthcare. Through Project Finish Line and this network, I believe we have 9 of our clinics participating from all different parts of the state. So that's super exciting. We have some urban and rural, again, like Joe said, some very big ones, some very small ones. So excited to see kind of how they all work together. As far as challenges in the pandemic goes, I think, I started this job back in July, so I kind of jumped right into the pandemic and everything. So this is kind of all I've known with CHN. So the first thing was, the uncertainty of the pandemic. Are we going to get a vaccine? When will it come? Best practices, securing PPE for our clinics. And then now, biggest challenge we're facing is, vaccine hesitancy, but also just vaccine resistance. So there's a lot of legislation going on in Ohio right now, trying to kind of curb businesses' rights on mandating vaccinations, asking vaccination status, stuff like that. So that's kind of our current challenge. But successes are, the majority of our clinics never had to shut down for a single day during the pandemic. They stayed open the entire time. And none of our clinics ended up going out of business or anything like that during the pandemic, which is super awesome. And then another thing that we did great was that we were able to get all of our clinics transitioned to EMRs, electronic medical records, and many of them also transitioned to telehealth and have since kept telehealth on, have been able to expand their services to, behavioral health, which has been super important during the pandemic. So that has also expanded their capacity as to who they can serve and how much they can do. For the Sostento team, it's been great kind of collaborating with Joe over the past year, giving feedback on FAQ documents, talking with the other state leads over the past year, just kind of disseminating that information, same as Joe said, just kind of having that social media advocacy as well, because I do a lot of our communications. Having the FAQ documents has been awesome. And, obviously now the vaccination network is going to be super awesome just for research sharing and that problem solving that we need. And also, like what Dennis said, just kind of expanding our capacity. So they are all focused on the pandemic. Obviously, as a state association, we weren't able to drop everything and just do COVID for a year. So that definitely gave us the assistance that we needed.
Thank you, Sydney. It's been great to meet you. And yeah, I think it's funny to say I've known nothing but the pandemic, but hopefully that won't continue. But I'm glad you also brought up some of the silver linings of what we've been able to do in advance in terms of telehealth, working in new ways, forming new partnerships through the pandemic. And I think the free and charitable clinics have had to do it out of necessity. There's no other way but to do it through new partnerships, trying new things. And we've seen that the grit and resilience, even with the funding not always coming through, that what they were able to do. So thanks, Sydney. And we were going to round out this month's State Lead Spotlights with Rufus in Virginia. Rufus, over to you.
Hi, everyone. It's great to be on this call, and really Dennis and Sydney said it all practically about what's going on. It's very reflective of what we've experienced in Virginia. We've got 61 member clinics with 70 locations throughout the state and serving just about 70,000 individuals throughout Virginia in rural, urban, and suburban settings. And I just want to make a big shout out to Joe and his team. You know, one of the things that's been, I think, tough on all of you, everybody on this call, is you know, it takes a tremendous amount of energy for the clinics to be doing what they've been doing on top of what they normally do. The pandemic was a huge burden, and to have your team, Joe, come along and help lift us up has really been helpful from a morale standpoint. It's been huge. It's always great to talk to you and your team. You all are full of energy and enthusiasm, and you know, we really benefit greatly from that. I can't say enough really about all of you, and the information that you've provided to the clinics has been crucial. Just like Dennis mentioned, we've shared that with not just the clinics, but with the Virginia Department of Health and others in our state, and they've all been really impressed by the toolkits, the expertise that you have brought to bear, and it's raised our credibility, just as Dennis said. I think the pandemic has obviously brought all of us closer together, and in the state of Virginia, we've never seen the kind of collaboration that we've had over the last 15, 16 months now. And that is something that we hope we can hold on to as we turn the corner on the pandemic. But we know we still have a long ways to go, and we're very happy about this initiative that you all have formed with the Equitable Vaccine Network. We have 10 of our clinics involved, I'm proud to say, and they're, you know, 10 fantastic clinics, all in different settings, doing what they can to get the vaccine out to those they serve. A lot of them have gone mobile. Some are doing, you know, very innovative things to try to get vaccines, I should say, to their patients where they live and where they work. We have a clinic that's working with Meals on Wheels in that sense and going right into homes. So, you know, I know it's not just about, as you said, Joe, you know, providing the vaccine. It's about partnering to get that done. And so maybe a third of our clinics are providing the vaccine in the state. The others are collaborating with various groups to get it done. I'm very happy to say that the state of Virginia is going to meet with us tomorrow to talk about new strategies for overcoming hesitancy and resistance to the vaccine. Part of that's going to be going to much smaller doses, so you don't have to have so many vials and waste vaccines, make it a little more flexible. They're also interested in collaborating on the mobile level. Maybe VDH would have the mobile units, but might be staffed by some of our free clinics. So a lot of great innovation going on. I think one of the things we're most excited about with respect to the Equitable Vaccine Network initiatives is the communications campaign. We really applaud you all for undertaking that. I know it's going to go on now for the next 6 months. You know, collecting and promoting stories about what clinics are doing to overcome hesitancy and resistance to the vaccine is vital. And we know that will make a ton of difference. We've done a fair amount of social media, just like the other states have, and that's paid real dividends. And your campaign will really complement a campaign we've had going on for the past year called Free Clinics Care. And I've noticed that we've gotten a lot more, I think, attention from donors. We've attracted more volunteers and attracted more patients actually for the clinics as a result of this kind of work. So thank you, Joe, again, you and your team, for everything you guys do. We're lucky to have you at our side.
Oh, thank you, Rufus, and I appreciate you having part of the network. All the clinics, you know, the state leads really make the engine go of this whole thing. Again, Sostento would not be able to have this outsized impact, just like the clinics have locally without the state leads. So thank you, Dennis, Sydney, and Rufus. Now we've had 3 clinics and 3 state leads, all from different states. It shows you just the diversity of ideas and perspectives, the common mission that we all have. I think it really felt like we had one voice among those. And we will spotlight other state leads on each webinar. So thank you everyone for those updates. Keep it going. So up next, we are going to go over the fundraising and operational resources that you can expect in the first resource drop, which will be coming out later this week. First, the fundraising resource. So the fundraising resource that we're going to provide for you all the clinics here is a way to go to your local Walmart or Sam's Club and request $5,000 in unrestricted funding. It's an opportunity that is available to anyone who's a nonprofit with a 501c3A status. You can ask for a grant from $250 up to the $5,000. You can see the deadline is between now and the end of the year. And basically, we're going to give you the step-by-step guide of how to do it. And if you have any questions or concerns about it, you can let us know. But literally, after you register, it should be less than an hour. You should be able to submit your application to your local Walmart or Sam's Club and give that a go. So that is our fundraising resource for you for this month. Again, each month we'll give you some kind of fundraising thing. This is different than the $10,000. This is not part of the $10,000 pledge. This is just our promise, as we've mentioned on the orientations, that we want to help set you up post-pandemic with additional funds. And so we'll give you fundraising capacity building strategies and things like funding opportunities or other tools and services to help you fundraise. So that's our monthly fundraising tool. And then our operational tool is our lovely Helpline SOS tool, which is a phone support service. It's a free service that Sostento has created that is going to be available exclusively to the clinics in the network. So let's take a quick look at what is Helpline SOS. So we launched this last March 2020. It was our first kind of service other than kind of giving out some information and helping clinics get reoriented to some telehealth and some remote working, was our phone support service. And so we have 35 clinics that are already currently using Helpline SOS. With that tool, we've helped clinics answer 100,000 COVID-19 calls. We are now expanding the tool to take other types of calls. So if you're a clinic and you feel like your phone rings off the hook, because we heard that sometimes it's really difficult to answer the phone even before the pandemic, this tool is going to be here to support you so you can focus on the vaccination work and not have to worry about, is the phone being answered and how many voicemails do I have to listen to? So that's what this tool is for. We hope it'll help with your operations. You can see this is a snapshot of the benefit and use so far. So go to the next slide. Just a quick look of how it works. Pretty much, you do not have to change your phone number. You do not have to change your phone system. And what you'll do is when individuals call into your clinic, certain types of clinics will get automatically forwarded to our Helpline SOS system. It will intake those calls and ask the callers automatically a few questions, key information like, are they a patient of your clinic? Are they looking for the vaccine? Do they have insurance? Yes or no? And there's some other additional things we're going to be adding to it. When those calls are intaken by our system, they end up in a cloud-based, secure, HIPAA compliant spreadsheet that then you can have your staff and volunteers make callbacks from wherever they are in the clinic, at home. They can handle your phone calls, and you can have multiple people doing it at once. So again, this is a 24/7 service that you apply to your phone line without changing your phone number or your phone system. It pretty much eliminates voicemails. So no more listening to voicemails and wondering what the person is saying. It'll be a very organized piece of information for the callback. We find that this is a platform to share information among the team for different types of callbacks. And Sostento will be providing scripts and best practices for how to answer the most frequent calls. So we have a whole FAQ to go with the phone lines of how to answer different vaccine or COVID-19 myths, for example. So your call team, we already are going to provide that for you. So that's a little bit about how Helpline SOS works. How long? What does it take to get started? Well, you will start being able to use the system within 1 hour. In a minute, we'll tell you about how you can sign up if you don't already have access. You'll sign an MOU, and the MOU will basically say, I allow Sostento and Helpline SOS to intake my calls, triage them, but you all are still responsible for making the call back. So we're kind of replacing your voicemail or your answering system in a much more organized and efficient way, but you are still in charge of making the callbacks. So that's what the MOU says. There's a 45-minute training that you will come to, and then it takes about 15 minutes to set up, and then you are taking calls on the system. So it's a streamlined process. We know how busy you are. We know new things can be scary. And we have learned and worked with charitable clinics across the 30 plus that we've done how to make this really easy and simple and start reducing your headaches within an hour or two. So that's what the setup will take. And then I think what we have next, we had a testimonial. Yep. So this is Brianna Lathrop from the Good Samaritan Health Center in Atlanta. She could not be here today. Likewise, she is seeing her parents for the first time in 18 months, but she did record us a little message about how the helpline has been used. She was the first clinic, and I think they've done more than, well, she might mention, but they've done thousands and thousands of calls with their volunteers. So Christine, why don't you play Brianna's testimonial for us?
Hi, my name is Brianna Lathrop. I am a family nurse practitioner and the Chief Operating Officer of Good Samaritan Health Center. We are a 501c3 nonprofit charitable care clinic in Metro Atlanta, Georgia. I'm really thrilled to be here and being able to talk about Helpline SOS. I wish I could be joining you in person, but I look forward to future conversations about equity and vaccination as we continue on this journey of helping our communities and patients respond to COVID-19. We initially started talking to the Sostento team in February of 2020. COVID-19 had just emerged. We were talking about shutdowns. There was a lot of unknown, a lot of questions. And one of my initial concerns was, what are we going to do with the influx of calls? How are we going to make sure that people are able to get a response when they need to, especially if we're trying to keep people out of clinics and hospitals that don't need to be there? And if you're like us, which I think most free and charitable care clinics are, we're already working at 100% capacity. How are we going to address an influx of need around a pandemic and still maintain all of our same functioning and adapt it to the new norm of COVID-19? This is really what brought on the discussions around Helpline SOS, and we were really privileged to be the first clinic to launch Helpline SOS in March of 2020. It fits with our existing phone system, and it simply was a way to make sure that we never missed a call about COVID-19. When patients call our line, the same line we've been using for over 20 years of our existence, they hear a message that tells them that if they have concerns about COVID-19 to dial a specific extension. That feeds them immediately into the Sostento Helpline SOS system. They answer some basic questions, and those responses populate into a live database that looks like an Excel document. Staff and volunteers, whoever's helping respond to those calls, are actually able to see that data coming in real time and then respond to those calls as they are able. This was really an essential tool for two reasons. First, was a quality of care issue that we wanted to make sure our patients, and then we wanted to offer our community a reliable, safe way to get information. And we were able to accomplish that by making sure that we never missed or never dropped a call about COVID-19. Secondly, we had a large pool of volunteers that were no longer able to come to the clinic, and the system allowed us to utilize their abilities and their energy by having them help us respond to call volume when we couldn't keep up. We've had, at any given time, we have about 80 volunteers that rotate through our helpline, taking shifts throughout the week. We have coordinators, a large response system, so that we're able to manage the influx of calls as they trend over time. Initially, we had kind of started off slow, and most of our calls were needing to speak to providers. As testing opened up in the community, we helped them register through the Department of Public Health. Then once we became a testing center, our helpline volunteers and the staff members that joined them were responsible for all of the scheduling. At one point, I believe over the summer of last year, our record was set at 350 calls in a single day. We could not have done that without Helpline and without the ability to utilize our volunteers who were at home working off the same database in real time. Then we became more recently a vaccination site, and once again we've been able to use the helpline as our way to not only open vaccination to our patients but our community at large. People can call in, they get a call that same day, our volunteers can schedule them, and it's been a tool by which we've been able to make sure that people don't have to sit on hold, they don't have to call multiple times, they don't have to be on a wait list. They call us, they get a response, and they get scheduled for vaccination. And again, we want to just remove as many barriers as possible to vaccination, and the helpline has certainly helped us accomplish that. I'm really thankful for the energy and expertise Sostento has put into making this program work for us. They've been responsive. They've been willing to adapt as our needs have adapted. And for us, it's been this really unique moment in which we were really able to step up in an environment where I was worried we would do just the opposite. To date, we've taken over 35,000 calls. That's responded to calls on the helpline. And I'm really proud of the effort that our team here at the clinic has put in, but also a massive team of what has amounted to over 100 volunteers that have been a part of this process and helping us respond. You can start big, you can start small, but I do think it is a tool by which you improve your efficiency, and you can guarantee that in the areas you feel the most fear, anxiety, or most pinched to be able to respond the way that you know your community needs and the way you want to, this has been a tool to help us make that possible. I'm always available, love to talk about ideas and how as a sector we move forward and do this work. And just really excited that you're here today and that we're thinking about the equity and about how we make this work for many moments to come. Thanks for joining us.
All right, so there's Brianna, who is one of our definitely power users of Helpline, but like she said, you can start small. Maybe you're just getting a few calls per week, and the baseline is a COVID-19 helpline, but we're looking to expand that to new use cases as well. So it will start as a COVID vaccine line for people to ask questions, make appointments, but there are other potential use cases related to your calls. So next slide.
Hi, my name is Brianna.
All right, so now maybe you're wondering, oh, how do I get access to this? I'm ready, I want the helpline. Okay, so you can sign up for the free helpline SOS license, which takes 10 minutes to register and 1 hour of training to get started. covidfinishline.com/helpline. Shawnee's going to put that link in the chat. There are 40 licenses. We're able to fundraise for 40 licenses. 14 have already been claimed. So we will do our best to accommodate everyone, but it will be first come, first serve. So the sooner you fill out that form, the better. You'll have the ability to shape what kind of future calls we intake and help triage. For example, I know the Medical Outreach Ministries group in Montgomery, Alabama is here. They've already helped us test out a prescription refill line. So all of the prescription refills we're actually able to take in for them and triage and help them make a call back for them. As an added incentive, those who sign up for the helpline and have it installed will get early access to our operational resource that's coming next month, which are going to be free vaccine rides from Uber. These are free rides that you'll be able to give and schedule for your patients, so they will not have to use the Uber app. You'll be able to schedule the calls for them as well. They are going to let you all, if you're doing outreach or vaccinations in the community, you will also be able to use the free rides. So that will be, have more information next month. But if you want to get early access to that, then sign up for the helpline. That gets you early access. As well, a lot of folks go, oh, I might put up a helpline, I might not get a lot of calls. Well, that's because you may need to market it and help promote it. So as part of this, we will also help you, if you decide to take on the helpline, to market it to your patients and your community to generate some initial calls into the helpline and get the word out about the service. So with that, what we're going to do right on the dot is we are going to take a 5-minute break. So everyone can get some coffee, use the restroom if they need to. And if you're a clinic thinking about helpline, you also have these next 5 minutes to take the sign up form. It should be done in 5 minutes or so. So we'll be back for the last 25 minutes of the call in 5 minutes. Until then, everyone, enjoy the break. And let's get down the home stretch of our first webinar. All right, so now we're going to do a few Sostento updates. So let's keep going. So I want to introduce you to the team. These are all the different faces from Sostento that are making Project Finish Line possible. You'll definitely get to engage and meet them as well as others along the way. We're also hiring a few new folks probably in the next few weeks. So as things roll along, there will be some new people to introduce, but this is our current core team. We're a very friendly bunch. So you can always feel free to ask us questions or voice concerns to us. They will get you to the right place or the right person, even if it's not them. So yes, this is a little look at our team. And we are going to have a Sostento Spotlight. So I am going to give a little bit of time of 3 of the team members that you're probably going to be engaging with, especially over the next month, to say a quick hello, tell you about what they'll be doing, and share a little bit about their role in the project. So Christine, over to you first.
Yeah, thanks, Joe. Hi, everyone. My name is Christine Hong, and I am the project manager for the Equitable Vaccination Network. I would first like to just welcome you all and say how excited we are to be working with you throughout the program. It was wonderful getting to know you during the orientation sessions, and we look forward to working with each of you throughout the project. With that said, if you ever have any feedback or questions for me or the team, please feel free to reach out to us. We are very eager to support you in whatever way that we can. So please be in touch with us with ideas and feedback. I, as a project manager, will be with you every step of the way throughout the program. So you will be hearing from me with more program details through emails, through engaging with you on our Facebook page, as well as connecting during our Sostento support hours and also the monthly webinars. I have an amazing team, a Sostento team behind me, and we're all ready and excited to start working with you. So again, welcome to the program and thank you for joining us today.
Thank you, Christine. Christine is definitely the train conductor on the project, making sure everything leaves the station and arrives on time. And Christine, now she'll be your main email contact. So whenever, make sure you save hers as a favorite contact for the next few months. She will be the one sending you important email updates and can be your main point of contact. So next, I'm going to go over to our clinic engagement consultant, who you may have heard from already, Ashani. Ashani, over to you.
Yeah, hi everyone. I'm so excited to be here. My name is Ashani and I'm one of the new hires as a public health consultant for the summer. I'm mostly going to be working on the Equitable Vaccine Network as well as Helpline SOS, which is coming up soon. I'm very excited to work with all of you guys. I'm also a public health student at Columbia right now, entering my final year. And I got to say, as a public health student, I have a lot to learn from all of you guys. All the important work that you guys are doing on the ground. I'm so happy to be involved with it and I'm ready to help you in your journey. So with that, I'm just going to pass it over to Simon and Emily.
All right. Hey, everybody. I'm Simon. I'm the Director of Growth for Sostento, but on this particular project, I work on the marketing and communication side. So you may hear from me and Emily to help your clinics get local press coverage. You may see us sharing stories on our social network. And what we are trying to do here is we're trying to raise awareness about how remarkable free and charitable clinics are and get those stories heard. Because in our conversations, we understand that there's a lot of misunderstanding about what it is that free and charitable clinics truly offer and just how remarkable they are, in my opinion. And we look forward to telling your stories and the selfless and important work that you are doing.
Thank you, Simon. Hi, everyone. Again, welcome. My name is Emily. I'm a doctor from Ghana, and I'm currently working with Sostento as the other public health consultant for the summer. I'll be working with Simon in the communications department to tell your stories and spotlight some of your clinics. And some of you guys may have already heard from us. I'm also about to enter into my second year as an MPH student in Columbia, and I'm very excited to be here. As both a physician and a public health student, I have already learned so much from you guys, and I know I'm going to learn even more as we go on with this project. So nice to see all of you guys.
Thanks. That's the Sostento team and just some other reasons you might hear from folks. So Ashani is going to be following up with you and just nudging you from time to time if you are behind on your progress update report or various things, or we need something for you in a timely manner. Ashani is sort of that follow-up if we haven't heard from you. So Ashani will be doing that. And Simon and Emily have already started storytelling. And actually, that's what I want to go into next. Christine's go to the next slide. So I want to give you a little update about that communication campaign. We realized that up to now, free and charitable clinics have not gotten enough visibility. People have not told your story. They have to a degree, but just not enough. So we are going to be investing in the next 6 months in a communication campaign that will focus on earned media. And by earned media, we mean that getting your local newspaper, your local television station, or a national outlet to tell your story. With that, we have a few goals. Of course, number one is to help with fundraising for you and for this initiative. We feel that if something ends up in the media and it's a great story, oftentimes donors come looking for you. So number one, we want to get earned media out there to help you fundraise. Number two is we want to raise awareness about the vaccination services that you're providing. So some of the stories may be, if you have a helpline, to try to get a little local story that the helpline is available, people should call, get a free ride if they need it to the vaccine. And we've heard that there's not only just vaccine hesitancy, there's some vaccine apathy coming in now that, oh, do I need to do it? Is it really for me? And we're hoping that by raising awareness of how convenient and easy you are going to make it, that we can get over some of that apathy. And then third and last, which Simon was mentioning, is we just want to raise the profile of free and charitable clinics in general in the health sector as a overlooked and sometimes confused with federally qualified health centers, what role that you all play and the value that you bring. So next slide. We've already started doing some early interviews with a few clinics. So I know you're here. Thank you for giving us your time as part of kind of our preliminary interviews around our communications campaign. So I think we've talked to some clinics in Wisconsin and Georgia, a nice mix. And we started getting some initial stories out there, and they're just amazing and powerful and need to be told. I put a few emerging theme areas of just things that I felt like I learned and saw across the 4 or 5 clinics that we interviewed. One is that you're all going that extra mile. I think it has to do with the volunteerism and the spirit of the free and charitable clinics, that you all have this deep cultural understanding that almost makes you all like family members with your constituency. And that's more than just translating something to Spanish. That is like a real cultural adaptation and understanding that allows you to work with an intergenerational household or with folks from different cultural backgrounds to have them feel comfortable and understand about the vaccine. And also folks meeting people where they are. That's both like based on their hesitancy or how much information they have, or that means going to the local poultry packing plant and running a vaccination, or the local prison or church. That's getting out in the community and not just sitting on your hands and waiting, but going out and meeting people where they are. And I think that's like part of the story of the uniqueness of the free and charitable clinics is that you have the freedom and ability to help anyone in whichever way you find best fit. So these are just some of the preliminary kind of things that we've been learning. Next slide. But we are not alone in doing this campaign. That is just some of the raw materials. So I just wanted to shout out, I know that they're with us on the call. We have hired an amazing powerhouse PR company called Kivit that will be helping us with a number of things on the campaign. So you may interface with Kivit at some point. It will be with a Sostento team member. So you can always feel comfortable telling your story with us, but Kivit will help us. They have the relationships and the know-how to get us into those earned media positions. So we're really excited to have Kivit on board for the duration of the program and to have their team involved in this. And they've been wonderful so far. I also want to send out a special thank you to the Rainwater Charitable Foundation. They are underwriting and sponsoring this communication campaign. So none of this would happen without the Rainwater team. They are really amazing. We met during the pandemic at a virtual conference. So it shows that sometimes you can make good connections at a virtual conference. And we've just been talking since then. And they've been doing a lot of innovative, like just filling spaces where, you know, the government may not know to go or be able to go. We know that's been a big gap, especially with free and charitable clinics. And we told them our story. Rainwater stepped up both to help resource the toolkit that you can access and now the communication campaign. So thank you, Rainwater team. We are super thankful to have you as part of our network as well. Next slide. Okay, so let's round it out with what you can expect, what comes next after this webinar. So first is to complete your clinic profile. So every clinic has been asked to complete this profile. This helps us ensure that we're providing the right tools and services to you, that when we have an opportunity come up, we know which clinic it might be a good fit for. So that clinic profile helps us give us a baseline about you. And we know you've told us it, but this is a way for us to really document it and for it to be in your own words. So that's the clinic profile. That's one thing if you haven't done it to start with. And I think we have a list. So you can see we have a lot of clinic profiles. So if you see your name up there, congrats. And if not, you might hear from Ashani in the next week or two asking you to complete your profile, but this is your chance to go out there and do it. But you can see we have a lot of clinics up there that have completed the clinic profile. So if you've submitted it, if you did the form, then you're all set. And if you haven't, please take care of that for us. So second is to complete your letter of support, which is your letter of commitment for us. Again, take about 5 minutes to do. It's a letter of support generator. So literally you go into a Google form, you put in your logo, the date, some other information, and it generates the letter for us. that helps us do the fundraising. So I think on the next slide, you have who's done the little less on the letter of support, but we still are making good progress there. But if you're coming and asking us about your 10,000, but you haven't done your letter of support, then we can't help you. But once you've sent your letter of support and commitment into us, that means we're already actively fundraising for you. And so thank you again to all of the clinics that have completed their letter of support. And all these links will be put in the Facebook group and in the follow-up email for you as well. So you don't have to rush to try to find it now. We will send you a summary email with all these things. All right, next is to join our private Facebook group and introduce yourself. So we decided to go with Facebook as a way that we thought most people would have access to this platform, and just a way to allow you to connect with each other informally over the duration of the project. It's a place, it's a private group. So if you post something in there, it's not going to show up in your personal feed. It won't be able to be searchable publicly. It is just a private Facebook group just for the members of the network. Our team is also going to be in there checking it daily. We may post an article from time to time. We'll put up all the resources we're talking about. And if you have a question, you could email us, but you could also just drop it in the Facebook group. And especially if it's something that another clinic might have an idea for you, they're going to see it. So we think it's a way also for clinics to engage with each other and put comments in there. So Shani, you at the end of the call, Shani's going to put the link to the Facebook group. So if you are not in there yet, and that can extend to our clinics, our sponsors, our PR group, please feel free to join the Facebook group. You're all welcome in it. But it is a private Facebook group, so we ask that you keep it within the walls of the Facebook group. So these are the steps. There's a login, you join the group, you introduce yourself, and then you're good to go. It'll show up in your newsfeed if you're a Facebook user. If not, you'll have to come to the page and see what the latest is. Another next step will be the Sostento support hours. So we're still trying to finalize exactly how this will work, but basically there will be multiple dates in a month where you are able to sign up to just drop in what we call a Sostento support hour. This could be, you just drop in, you're facing a challenge, you're trying to troubleshoot something, you have a question about the program, maybe you might want to use the helpline, you did the orientation, but you still have a worry about it or something, or you want to know about some new ways you could apply it. That's what our Sostento support hours are for. They're kind of like open office hours for you just to drop in with our team. And we're going to see how you all use it, and then we will evolve it from there. So please feel free to join. If you just want to jump in for a cup of coffee and say hello and vent about the terrible anti-vaxxer that just came into your clinic and how terrible they were, that's something you can also do at the support hours. We're here for you just to vent as well. And you'll be getting a link to that. It'll be the same link. So there'll be one link that you can always go and sign up for support hours. It's a similar system that we use for the orientation. So you'll see times that are open and that you can join. So we hope you take advantage of that. And whoever does take advantage, you'll help us shape what the future support hours are. So lastly is the next webinar. So we are going to be doing these monthly for the 6 months. The next webinar will be on July 21st at 1 p.m. We'll have some new special guests, some subject matter experts joining us. Next month, we'll have Stop the Spread that has built expertise on pop-up community clinics, and they will be joining us as well. We'll do clinic spotlights, state lead spotlights, talk about the new operational resources, maybe special surprises if we could have any. I'm going to do it during the webinars to incentivize you to come, but we'll send out invites. So you don't need to put on your calendar. Christine will send out an invite for you all to join. Ashani also put the link into the Facebook group in there for you to join. So do that on your way out. And I think that is it. So I'm this is just such a joyous occasion to be able to run this webinar with you all. Maybe the last thing we could do is if everyone, there's come on your video, if you're off video, if you can come on video, we're going to do a group snapshot of everyone here. So I think I have someone on the team who's going to do it. So there's a reactions button, and you can put up an emoji based on how you're feeling. So maybe I'm going to count down from 3 and 2, 1, find those reactions, and you can put the reaction up, and we'll take a group snapshot with all our reactions. I'm going to pick out mine. Okay, ready? 3, 2, 1, put up your emojis, and we'll do a snapshot. So I know someone to do it. All right, cool. All right, Well, with that, that is the end of the webinar. The team will stay on the chat. So if you want to stick around, type in any questions, but we can finish the recording here, Christine. We can end that here. And just thank you and send you all 10 minutes early out of the call. We always will try to end a little bit early to give you some flexibility onto your next thing.